Simple home remedies for morning sickness. Morning sickness, the unglamorous side of pregnancy. It's like your body throws you a surprise party every morning, complete with a never-ending wave of nausea and an unwelcome urge to visit the porcelain throne. But don't worry, dear mother-to-be, you're not alone in this perilous journey. Many expectant mothers experience morning sickness as their bodies work their magic to nurture a tiny life within. It's nature's way of reminding you that you're on an extraordinary journey with unexpected twists and turns. Welcome back to another episode of Omagi. Today, we will talk about simple home remedies for your morning sickness. When it comes to combating morning sickness, sometimes the simplest remedies can work wonders. First, what is morning sickness? Morning sickness, also known as nausea and vomiting of pregnancy, is a common condition that many pregnant women experience. It usually happens during the first trimester, but it can last into the second trimester or, in some cases, the entire pregnancy. Morning sickness affects between 70 and 80% of pregnant women to varying degrees. Morning sickness, contrary to its name, can occur at any time of day or night. However, for many women, symptoms are often more pronounced upon awakening due to an empty stomach. The exact cause of morning sickness is unknown, but it is thought to be caused by hormonal changes, specifically an increase in human chorionic gonadotropin, or HCG, and estrogen levels during early pregnancy. Morning sickness can also be caused by heightened sensitivity to certain smells, a heightened sense of taste, and emotional factors. Morning sickness symptoms can range from mild to severe and include nausea, vomiting, loss of appetite, fatigue, and sensitivity to smell. So now, let's dive into easy and effective home remedies that may help you conquer those relentless waves of nausea. Simple home remedies for morning sickness. 1. Consume regular, smaller meals at intervals of 2 to 3 hours. Did you know that keeping your stomach slightly full can help you feel better in the morning? Allowing your stomach to empty causes it to produce more gastric acid, which can contribute to nausea. You can help regulate your blood sugar levels and keep your stomach from becoming too empty or too full by eating small, frequent meals every 2 to 3 hours. This method can provide a consistent supply of nutrients to both you and your growing baby while also lowering your chances of experiencing severe morning sickness. 2. Ensure that you include an ample amount of ginger in your diet. Now, let's discuss the incredible benefits of ginger. Ginger has long been recognized as a natural remedy for digestive problems, particularly nausea. It contains gingerols and shogales, compounds known for their anti-inflammatory and calming properties. Adding ginger to your daily routine can be as easy as enjoying a cup of ginger tea or incorporating freshly grated ginger into your meals. Ginger candies and lozenges are also convenient options to carry with you when you're on the go and need to alleviate nausea. Even a small amount of ginger can have a remarkable effect and bring much-needed relief during those difficult mornings. 3. When you feel nauseous, eat something dry and avoid drinking fluids. When you feel a wave of nausea coming on, it's critical to have some dry snacks on hand. Dry foods such as toast, cereal, or plain crackers can absorb excess stomach acid and aid in digestion. These bland but comforting options can provide some relief and keep your stomach from feeling empty, which can aggravate morning sickness symptoms. Keep a stash of these handy snacks in your purse or near your bedside table for when you need a quick fix. 4. Acupressure technique to deal with pregnancy nausea and vomiting. In addition to these food-related remedies, you might want to look into acupressure. Acupressure is an ancient technique for relieving various ailments, including nausea, by applying gentle pressure to specific points on the body. The P6 or Niiguan point, for example, is located on the inside of your wrist. Applying pressure to this point with your thumb or using acupressure bands may help reduce nausea and vomiting caused by pregnancy. It's a non-invasive, drug-free method that some women use to manage morning sickness symptoms. 5. Avoid spicy and oily foods. While spicy and oily foods can be a tempting temptation, it's best to avoid them during pregnancy, especially if you're prone to morning sickness. These foods can irritate the stomach lining, causing or exacerbating nausea. Milder options can help keep your stomach calm and reduce your chances of experiencing discomfort. 6. Avoid drinking tea or coffee. Finally, let's talk about beverages. As much as you enjoy your daily cup of tea or coffee, it's important to keep the caffeine content in mind during pregnancy. Caffeine is a stimulant, which may contribute to nausea and heartburn. Consider switching to herbal teas or decaffeinated options to see if it improves your morning sickness symptoms. Water is essential for staying hydrated and supporting your overall well-being, so drink plenty of it throughout the day. 7. Try eating bland foods. When suffering from morning sickness, eating bland foods can be beneficial. These foods have a mild flavor and are easy to digest, which can help to soothe your stomach and avoid further discomfort. Crackers, toast, plain rice, and broth-based soups are examples of bland foods. Saltine crackers are a popular choice because they absorb stomach acid and can be eaten as a snack before getting out of bed or throughout the day. Plain white toast is high in carbohydrates and can be eaten alone or with a light spread. Plain rice is easy on the stomach and goes well with cooked vegetables and mild seasonings. Soups made with broth, such as chicken or vegetable broth, provide hydration and easily digestible ingredients. 8. Eat foods with vitamin B6. Vitamin B6 supplementation has been shown in studies to help alleviate symptoms of morning sickness. However, it is critical to consult with your healthcare provider before beginning any supplementation to ensure the proper dosage and safety for your specific situation. Increasing your intake of vitamin B6-rich foods is another potential way to reduce nausea and vomiting. Foods high in vitamin B6 naturally include bananas, avocados, and chickpeas. Incorporating these foods into your diet can help you get the nutrients you need while also potentially alleviating morning sickness symptoms. It's not easy navigating the ups and downs of morning sickness, but you've armed yourself with knowledge, remedies, and a sense of humor along the way. Remember that morning sickness during pregnancy is only a temporary setback on your incredible journey to motherhood. It's a reminder that inside you is growing a tiny human, a little miracle in the making. So ride the roller coaster, celebrate your victories, and laugh at those giddy mornings. You can do it! And when the storm passes and you can finally hold your precious bundle of joy in your arms, you'll look back on these times with pride and accomplishment. Keep munching on those ginger snacks, savoring those dry crackers, and staying hydrated with a cup of soothing herbal tea until then. And that wraps up the video. Do you have any questions or reactions? Feel free to write them down in the comment section below. This is Amaji, and we will see you in the next video. Thank you for watching.